So tell us who you are and a little bit about yourself.
My name is Norm Killip. Actually, I'm from Flagstaff, Arizona, and I had knee surgery, full knee replacement, 14 weeks ago, and I'm so elated to have had it done because it's just really changed my life back to be normal like it should have been, where it wasn't. And it's one of those things I kept putting off, and I probably put off a year longer than I should have. And now I'm so happy I did it.
And what are some things that you're back to doing now that you couldn't do before your surgery?
Mainly walking, just daily things, getting up out of a chair, doing things that I had to move my knee or my leg to compensate for things that I couldn't do before. And I've been just so happy I did it.
And tell us about your after, like your experience afterwards. Were you in a lot of pain or?
Actually, minimal pain after the surgery. The day after the surgery, I took the oxycodone, which I found out didn't do any good. So I went right away to the Tylenol, which I stayed on that for maybe 2 weeks. And after that, I got off of that, and I don't ever take it anymore. I have no pain at all.
You know the answer. So what advice would you give to someone who's thinking about getting their knee replaced but maybe is scared or putting it off?
I think anybody that's got into the position where they need knee surgery hears all these horror stories from people that haven't had the drive or the willpower to go through it. And once you get it done, it's not near as bad as what everybody thinks it is. Mm-hmm. I've been in physical therapy for 3 months now, and they're doing things that make you stronger than you were before, more flexible, more balanced, and more comfortable in your daily life because you had this done. If you didn't have this done, you would be fighting everything that you did, bending down to tie your shoes, bending down to pick up a pencil, sitting down in a chair, riding in a car. It is so good to not have to fight that, which I fought for years when I should have had it done sooner.
Right, or think about it. Like you don't have to think about bending down anymore, right? Where you probably did before.
Well, that's the thing. You're not, before, and I still do it, which I fight myself because I knew if I turned the corner real sharp in a walk or did something that was going to hurt. But after the knee surgery, you do that and it doesn't hurt, but you say, why did I do that? Because you hurt before.
Right.
And now you don't, and so it's wonderful not to have to do that.